The sign's up. We're ready to go. Yep, you're ready.
We okay in here? Yeah. Well, welcome. The very interesting day today. This morning we were awakened by exploding transformers in my neighborhood and big blackout, and I've never seen anything quite go off like that wasn't a bomb. So it was a quite amazing view. Today we're talking about trade missions, a framework for initiating multinational collaboration. It's hard to read anything about Shirley because I think I've heard everything or seen everything, but just a few details. She has a bachelor's and a master's from the University of Waterloo. She's the managing director of the Waterloo Institute for Health Informatics Research and a research associate in the Computer Systems Group. Shirley is a program manager of the Applied Health Informatics Bootcamp, without which it wouldn't exist. She's done incredible work pulling that thing together, so if you haven't looked at that on our website, please do. She's building active research and technology transfer relationships with healthcare providers, not only in this program but many others. And she's a member of COACH and also a member of the Intelligent Waterloo Steering Committee, which we're just having a few laughs about. But the personal part of this is when I came here in 1998, I came across Shirley and really didn't work with you until about, I guess 2000, 2001. And when I was able to come on full-time here, one of the things I said at my kind of inaugural speech was that I'd found this secret weapon at the University of Waterloo, and it was Shirley Fenton. That's one of the few things in my life I've been right about, and that's really paid off. And Shirley not only is a highly capable organizer, but can take on and has taken on many of the individual research projects and programs that we've gotten underway. And I mentioned just briefly the boot camp. The work that Shirley's done in making the boot camp happen has made it into a national monument in terms of an educational program. Over 340 students have taken the program, more than I think have been produced by any group in Canada, or close to the even if they've gone 20 years. So an amazing reach in that program. And that's just one of many, the Smarter Health series, which is on this Wednesday, and she'll talk at the end about David Koff's presentation that's coming up. Research seminar series, in which she's giving one of them today. Many, many activities, but founded in quite a few individual research projects that have been with people like Smart Systems for Health Agency, Victorian Order of Nurses, a number with different companies, so an incredible background of program management, but also her own work that she's done in these research programs. So today, Shirley, I'm waiting to hear about trade missions. We formed a small jeering committee in the front, and I'll refrain from holding up the applause sign periodically. Thank you.
Well, thank you. Thank you, Dominic, for that interesting and complimentary, I think, introduction. I had the one of the most interesting experiences I think I've ever had on going on a trade mission earlier this year. And I want to share with you today some of the things that I learned and how trade missions can really be a framework for initiating what we call multinational collaboration. So in terms of this seminar, this is a brief outline of what I'd like to go over today. What are the purpose of Canadian trade missions? I'll give a brief overview of the one that I was on, the eHealth trade mission. Some of the observations and highlights from that trade mission, words about the Canadian delegation. I talked to John Tennant before I went on the trade mission, and he gave me some insights, and he was dead on when he talked about the value of going on a trade mission and learning about your partners. I will finish up then with the trade mission, its value and opportunities, and some conclusions based on that. So what are the purpose of trade missions? In general, I think this would apply to any trade mission, is to raise awareness of and showcase Canadian research, industry, and markets. The goal is to open those doors for collaboration with all of those involved in research and markets, companies, industry, universities. The trade mission that I was part of was called the Canada Day, ICT Canada Day Trade Mission. It was focused on eHealth, telemedicine, and health informatics. So prior to the one that I went on, there were 3 previous ICT Canada Day trade missions. They were organized by the Canadian embassies in Oslo, Stockholm, Helsinki, Copenhagen, The Hague, Brussels, and the Canadian Consulate in Munich. So the one in 2008, as I mentioned, is focused on eHealth, telemedicine, and health informatics. It included 8 Canadian participants. There were 7 events, and that was over a course of 10 days. So here are the countries that we went to. I'll just show them on the screen here. So we went to these countries here. So, and I don't know whether you can see Denmark here. We went then to Belgium and the Netherlands and did a very quick journey into Germany as well. In those countries, of course, we didn't go touring all over the country. We hit the capital cities of Oslo, Stockholm, Helsinki, Copenhagen, Brussels, Erlangen, and Amsterdam. So the eHealth Trade Mission, in terms of its organization, it had 7 events, but each country organized its own event. The events were held at a variety of venues. So one time it would be at a hospital, the next time it would be in a conference room, the next time at a research park. We had one at a Canadian ambassador's residence. And finally, in the Netherlands, we had the, I think, fabulous fortune of being at ING headquarters. This building is, if you've ever seen it, a picture of it, it's built like a ship. Well, some say it's a ship, some say it's a boot. And it's all in glass, so it's a most amazing building. It's up off the ground, and you see it from miles around. Each event included presentations by the Canadian delegation, but it also had many opportunities for collaboration, one-on-one meetings, meet and greet, networking time, post-events at company venues. So it was quite an array of opportunities to collaborate. And as I noted, we traveled a lot in those 10 days. At this point, I'd like to switch into some of the learnings from the trade mission. Each country provided a lot of opportunity to getting to know the people, some of the issues that they faced, the things that they were trying to do in their country, particularly in the area of healthcare, eHealth, telemedicine, and their organization for healthcare into the future. I'll start with Sweden because that was the first country that we visited. As you know, Sweden is bilingual, Swedish and English, 9 million people. It's the 3rd largest country in Europe, and it has many similarities to Canada. In particular, the northern area is very similar to Canada. Its high tech is similar, industry is similar to what we do in Canada. Its welfare, tradition of social welfare is very similar to Canada. And but least, it's an EU member. I won't spend a lot of time on some of these slides that talk about healthcare, but try to just hit some of the highlights. This presentation will be made available to you from our website, so you can take a look at it in more detail. There's quite a bit of information on these slides about their healthcare, where they're moving to, and so on and so forth. I guess the thing that jumps out at me is that Sweden, in many ways, seems to be more advanced than we are, but it's a very complicated structure that they have. They have in their country 9 what they call regional health authorities, plus 2 special ones for the southern area. They're linked by a high-speed capacity network, very much like what we have in Canada called Canary. And they're implementing, or they just have implemented, a national IT strategy for healthcare, which is really pushing IC adoption into their health system. One of their key concerns is how to care for the elderly, and that is organized separately by 290 local government boards. The regional health authorities, they apply the principle of one patient, one journal. So, in other words, one common database across all healthcare services within a particular region. But note, however, that they are moving along in terms of e-prescription. 55% of all prescriptions are dispensed electronically, and that's the highest figure in any OECD country. By the way, this information is largely taken from, and for each of the countries that you'll see coming up, from the notes that were provided by the trade commissioners from each country. They are a source of knowledge, and it's just amazing the background information that they were able to provide to the Canadian delegation. This just gives you an idea of their computerization of healthcare documentation. Note that primary care is at 95%. One of the most notable things that I thought that I found in the entire trade mission was this program called Action. It's a very innovative caregiver support program where it provides healthcare services and consultation to the home. And they do this via video cam, telephone, and the internet. They incorporate the telephone because it's a very easy to use service that people understand. The elderly or anybody can use the telephone, so it's still very much part of the system. This was initiated in 1997 as an EU project, but it has really gone forward quite strongly in Sweden. There's a little picture, as you see in the corner, of two, a husband and wife, I believe, interacting with their Action system. And they can talk, they can include other family members in that interaction along with the healthcare provider. I was very impressed with this system. Maybe something that we can learn from here. Moving now on to Finland, the second country that we journeyed to. And by the way, it seemed that we didn't see very much of the country because we'd arrive at night. You get up first in the morning, go to your meeting, and then you dash off either by bus or taxi or whatever to get to the airport and arrive in the country at night. So you really didn't see too much of each country in that type of travel. Finland, 5.3 million people, 2 official languages. And it's a very interesting country because it has been ruled by Russia and by Sweden for many, many of its years of existence. Again, it's some similarities to our country. We share that same far north area and the problems and the good opportunities that come along with that. So Finland boasts one of the best healthcare systems in the world. It too has a social welfare system for healthcare. It's recognized for their R&D, and it has a high deployment of computerization in the healthcare system. So there's a lot of details on this slide, so I won't go through all of them, but you can read them at your leisure later if you wish. Patient data is shared, and data systems are integrated through secure platforms. They've implemented a mandatory system for public and private healthcare providers called the Finnish National Electronic Patient Record Archive. And their goal is really to have their healthcare professionals to have access to one common database, no matter what their IT system is running on. You see some stats at the bottom of where they are in terms of computerizing and making their electronic patient record available in various sectors of healthcare. They've implemented or initiated the FinWell Technology Program, initiated by industry, and the goal of that program is to improve the quality of healthcare and its efficiency and productivity. So the key trend there is to move away, much like we're seeing here, from acute illness treatment towards health improvement, with a particular focus on their aging population. And that was a common theme throughout all of the countries that we went to, how to cope with the aging population. How do we get services into the home or into the community? So here are some of the key drivers for what they're trying to do in eHealth to, as I said, to increase the efficiency and productivity. And it notes some of the ways that they're trying to do that, how to cope with their aging population, how to cope with lifestyle-related diseases, much like we're trying to figure out how to cope with diabetes here and obesity. And here are some of the challenges that they're going forward with the digital delivery of care. They want to make ICT everywhere in healthcare, that they put the patients into the driver's seat as much as possible, and reduce the amount of information overflow. There's an interesting relationship between Finland and Canada in terms of healthcare. There's been a long time cooperation between Finland and Canada in terms of eHealth and telemedicine. And the CIHR have a memorandum of understanding with the Academy of Finland for addiction and substance abuse research. I didn't know that until I went on this trade mission. And that's something that happened repeatedly throughout the trade mission. I would learn things about what was going on in Canada that I didn't know until I went on the trade mission. I had to learn it while I was away. So to continue on, Finland institutions are very interested in Canadian projects, particularly in Canada Health Infoway, and I believe that they have met with them several times, or people from their country have met with them. Moving to Norway, it's one of the world's richest countries. All that oil, not a bad thing to have these days. They are some of the top per capita users of ICT, one of the most wired countries in the world, and they are known for their telemedicine. Now, if you know anything about the countryside in Norway, this would be a natural because it's a very mountainous topology. They have a subarctic climate like we do, and the population is very low. So there's long traveling distance. One thing, though, about Norway, it's not an EU member. However, they still have access to the EU market through the European Economic Area Agreement. They, too, have a well-developed health service, and its core value is that everyone should have equal access to high-quality, public-funded health care. They have a very ambitious program in terms of eHealth. They have just started their national health program, and you see the list of things that they're trying to do underneath that program, all the way from establishing a norm for information security, implementation of an EPR, developing a program for e-prescriptions, and so on and so forth. Many of these programs that they're developing are underneath something called Teamwork 2007. So how are we relating to Norway in terms of eHealth and health informatics? As I said, that Norway is a leader in telemedicine. And there's been a lot of interaction between Canada and Norway in terms of telemedicine. Norway hosts an international conference in eHealth and telemedicine. They have a center for telemedicine called Norwegian Center for Telemedicine. And it was showcased by the World Health Organization. In terms of health informatics research, there are several universities and centers that are very active in health informatics. The Norwegian University of Science and Technology, the Norwegian Center for Informatics in Health and Social Care, and SINTEF Health Research. It's a private research organization. So it's interesting to note that they want to collaborate with us, and they want to do research with us. So there's bilateral projects underway, and this is being facilitated by the Research Council of Norway. So we're almost halfway through the trade mission now, with Denmark being the next stop. It's one of the wealthiest countries in the world, and it is known for its life sciences industry, particularly pharmaceuticals, biotechnology, medical disposables, and electronic medical devices. The key area that has this research and development underway is called the Medicon Valley. And I think Perry Chu would probably be familiar with that cluster. In terms of healthcare, they're moving ahead on their eHealth and telemedicine program as well. They're very keen on what they call the hospital IT and developing new wireless communications, electronic patient journals. They want to go ahead with pervasive health and technology into the home, using RFID, technology, and really just making the patient do as much as possible in their own home environment. In terms of eHealth, they are moving ahead in terms of their general practitioners and their efficiency. So they're almost totally paperless in the doctor's office. And they've also implemented a very interesting Danish patient portal. You can see the list of information that is available to the Danes on that portal, all the way from information about all the hospitals around Denmark, waiting list information, much like we have here now in Ontario, an e-booking calendar, and so on and so forth. One of the smallest countries that we visit, Belgium, 10.3 million. And it's a very interesting country in how it's divided into their three regions, Flanders, Wallonia, and Brussels. And it has three communities for speaking, Flemish, French, and German. In terms of healthcare, their system is based on a compulsory social health insurance model. And it's noted to be one of the best in the world, but also one of the most expensive in the world. They have an official eHealth roadmap in order to try to coordinate all the players in this very complex institutional country. Large number of participants are involved with those three areas that I mentioned, and so they have come together with this eHealth roadmap. eHealth is publicly funded, but interestingly, mainly privately provided. So in terms of eHealth or healthcare and eHealth in Belgium, again, they note that the aging of the Belgian population is a real concern and a real driver for what is going to be developed in terms of healthcare services. It's the driving force behind the issues for the patient's rights, privacy, data protection, medical services liability. They have a real concern about this whole privacy and security issue. And to that end, they're developing, and maybe it's approved already, a health telematics law. To put forward their development in terms of healthcare and eHealth, they have the eHealth program, and along with that, they're developing the Belgian Citizen eID program, a smart card, to store their health information, and also, as well, a summarized electronic health record. There's activity in terms of health informatics in Belgium, and their aims are to provide information access to care workers wherever they are. Sounds similar to what we want to do here. They want to provide information and services to patients and get them more actively involved in preventative health care, setting up databases to monitor healthcare services. And I guess of special note, our partner down the street, AGFA, that's their home base is in Belgium. We're getting close to the end of the trade mission tour, a snapshot tour here with Germany, one of the, I guess, the largest populated countries that we visited. Interestingly, English was not as prevalent when we went into Germany. Unlike the other countries that we visited, English was very common, but Germany was not as, English was not as common place in Germany. They too have a federal strategy for implementing ICT into their healthcare sector. Their three priorities are listed here in terms of what they want to do. The first two are mandatory, but the drug interaction and contraindication checks are that's a voluntary system. They have an eHealth strategy, the implementation of a voluntary private electronic patient record, along with several other applications. And the foundation for all of this, their eHealth strategy, will be their smart card infrastructure, in which Germany is a global leader. They have significant interest in electronic patient journals, RFID applications, wire applications, very similar to what we're very interested in developing here in Canada. And last but not least, the Netherlands. Here, this gives you a snapshot of sort of a comparison between Canada and the Netherlands. We have double the population of the Netherlands. I won't even try to figure out how much bigger we are in terms of area. Very similar in terms of life expectancy. Interestingly, though, we seem to be a little bit fatter than they are, but they seem to smoke a lot more than we do. So I just found that comparison interesting. That was taken from one of the presentations given to us in the Netherlands by Evelien Kastelen-Luns, if I can say it correctly. So they're interested in developing an electronic health record and other these applications, eLab, emergency dataset, ePathology records, eChildren records, and reference architectures. I met a very interesting doctor in health informatics when I visited Netherlands. She's very interested in web-based tools, lifestyle coaching, teleconsulting and video conferencing, and eHealth research. So I'm hoping that we can continue to develop a collaboration with her. So from all of these very brief tours of countries, I think I've indicated that there are many similarities. Similarities in terms of geography, values, and challenges. We're all countries that are very modern. We are export-oriented. We have a very solid social healthcare system for the most part in all of those countries that we visited, as we do here. The European countries that we visited have the same challenges, very similar challenges that we do in terms of aging population, chronic disease, obesity, providing senior care in the community. And in terms of healthcare, what they're looking at and what we're looking at, the problems that they're facing and what we're facing, again, very so many similarities. They indicated that their services are not always cohesive, that the user-patient experience is disjointed or not as good as you'd want it to be. Patient error seems to be, medical error seems to be rising. That depending on where you live in the country, there could be differences in the quality of care, the availability, waiting times may vary across, may be dependent on where the person lives. And telemedicine seems to be something that could provide better access of healthcare to everyone. And so there is a real concern and drive to implement telemedicine in all of our countries. I'd like to switch now to the Canadian presentations. As I indicated, John told me that one of the good things about going on a trade mission is that you learn so much about your country, but also you become very knowledgeable about the people that you travel with. And they can become some of the best partnerships that you can form from a trade mission. So what did the Canadian presentations do? They certainly gave a picture of what's going on in Canada in terms of healthcare and eHealth, telemedicine, health informatics, who the industry players were, where R&D was happening, and I did my best to try to tell them about what was going on in health informatics, not only here but right across Canada. A number of them gave points on how to do business in Canada, and they noted that if they were coming from Europe, one of the best ways of getting into the US market was to come to Canada, form a relationship with a Canadian company, because they will have the knowledge and expertise of going into the U.S. market, and that the European country could gain, company could gain from that. And lastly, a number of the participants showcased their company products and services. So there we are. Looks more than 8. I guess there are a couple. Some people had two members on the team. The Canadian delegation had three speakers. Dr. Penny Janet from the University of Calgary. She's a pioneer in telemedicine. She's very knowledgeable about what is going on in Canada in terms of eHealth, health priorities, market opportunities, challenges. She's very well known in the European countries, has done research with the European Union, has done a number of research projects with Norway. I believe it was Norway and Finland, perhaps even Sweden. Wayne Goodbranson from the Branham Group is one of the most knowledgeable people, I think, in terms of what is going on in Canada in terms of eHealth. He and his company have developed something called the Branham eHealth Study. It looks at the eHealth sector, all the companies that are in Canada as much as they can, and get information from those companies. The Branham Group does very in-depth studies of these companies and gains a lot of information from them. And from that, they develop what is called the top 10 in terms of eHealth companies. And I'll show you those in just a minute. Myself, I talked about health informatics. There's sometimes confusion, just what does health informatics mean? So I tried to give a clear definition, what's going on in terms of Canada and health informatics education and R&D, areas of commonality if we were to work together. And we proposed, this is something that Dominic came up with, something called the health informatics dating game. So when we went to each of the events, how could we engage with the people in that room so that the relationship would go on beyond walking out the door? So it would continue once we left. And one of the ways is to make everyone aware of what are the players involved in all of the countries. And I don't think there exists such a database or a capability of providing that information. So we proposed to the people attending the trade mission, if they would like to join with us in trying to develop this information, we'd be very happy to do so and try to make that available on a website. As I mentioned, Wayne Goodbranson's group has developed this huge database on eHealth companies in Canada. Here are the lists for the 2007, led the way by TELUS. Third on the list you see is Emergis, and they're now part of TELUS. So I guess somebody else will, and I've only got 9 here. One must have fallen off the screen. So there is one more on the list here, and I'm sorry I can't remember which one it is. In terms of the Canadian delegation, the industry participants, actually there were representatives from across Canada, so it was very interesting to meet these people. Right across the road from us, Dave Wilson represented AGFA, and he had to leave halfway through the trade mission, and so Fiona Beardwood, who was in Belgium at the time, then continued on. Representative from Nortel was Lawrence Beaulieu, and he talked about networks, sensors, and their work in those areas along with workflow. The CEO of Informatics Technologies, Brian Eckhart from Winnipeg, their company is very involved in registries, eHealth, EHR integration, portals, telehealth. A company in Toronto, Interfaceware, they talked about their software programs to support HL7, Iguana, and Chameleon. And last but not least, Scott Campbell, the CEO of Medusa Medical Technologies in Halifax. They've developed a program called Siren. And if I can just get out of this, I will try to introduce you, show you a little bit of what Siren is all about. So...
Just between life and death, Doncaster and Sheffield were the first places in the country to start trials of the new mobile technology. And what's been discovered here could soon help patients all over the region and then spread out nationwide. Our health correspondent Penny Bustin was given exclusive access to see just how it works.
It's the sort of incident that greets ambulance crews every day. A man collapsed with chest pains. The priority for the paramedic and emergency care practitioner in what could be a life-threatening situation is to give him immediate care.
How long you had these chest pains for?
Well, just for a few minutes. I came out there and...
But their task also is to gather information that will help his future care in hospital. In most ambulances, that means a pen and paper exercise. Welcome to the paperless ambulance and Tough Book, an onboard laptop with touchscreen technology that enables information about the patient and the treatment he's been given to be transmitted to the receiving hospital.
It's a lot easier to put the data in. The writing's legible rather than the bumpy scroll. Obviously, in back of one of these, it's difficult to write. The information in the Tough Books is far more comprehensive than we could ever even dream to put on a bit of paper. It also prompts you symptoms-wise, so you can go through symptoms and patients' conditions far more than you would ever on a bit of paper.
Meanwhile, in Doncaster Royal Infirmary, the wireless transmission means A&E staff are alerted to an incoming patient's condition. When everybody has an electronic patient record, that could be called up too. The technology comes from North America, but has been developed in South Yorkshire.
The process involved initially taking the original North American product and starting piloting almost with that product.
Now, it's interesting that that little video clip claims that the technology was developed in England. That's not the case, actually, but it was never corrected. So that was developed by the company in Halifax. And I thought it was a very interesting product that they've developed. It's the whole software system that they've developed, but then it's been implemented on this very hardy type of small laptop. But keeping in mind that when you need to record that information, it will not be in the most, possibly the most amenable conditions. You may be on a roadside, you may be half under a car, you may be who knows what, and you've got gloves on and you're trying to type, and this has proved to be a very, very interesting way of providing a mechanism for getting information at that point of care environment to the hospital before the patient arrives. They now, I think, have implemented this system in some 35,000 ambulances in Europe, and I think they have 25% of the market share in this area. So I thought it was a very interesting product that they have made available. So that brings us almost to the end of my presentation. I guess I've got to bring you back into looking at what I'm doing here. And to finish off, so what was the value from the trade missions or trade missions in general? Well, as I've indicated a number of times, there are so many similarities between their countries and our country. And that makes us, I think, mutually attractive partners. If we became business or R&D partners with their companies or their universities, that opens the market to the EU market. There are many possibilities, I think, on a university basis for research collaborations, faculty exchanges, student exchanges, co-hosting workshops or conferences, so many opportunities of how we could work together. One of the things that we've told people repeatedly is that we have a real shortage of health informatics, skilled health informatics people. They too have a real shortage. How are we going to get all this work done when they've got a shortage of people? We have a shortage of people, so doesn't it make sense that we just all work together and try to get some of this work going along as fast as we can? In particular, I guess I learned a lot about those countries. I've tried to share with you some of that intelligence today. I found it very useful to inform them as to who we are and what we do. many of the people that attended the events, and I understand that they were, this year's was the largest attendance that they've had of the 4 years. Most of those people had not heard of the University of Waterloo. They had heard of many other things going on in Canada, but not the University of Waterloo. And they were very intrigued with the University of Waterloo, its capacity for doing research, the spin-off companies that I mentioned, its R&D capabilities, its IT policy. In fact, we've talked to one of the Canadian partners about the IP policy that we have at the University of Waterloo. So there are many opportunities for informing people about what we do here in Waterloo, what we do here at the University of Waterloo, what we're doing in health informatics, and what other researchers are doing on our campus. They were interested in our new School of Pharmacy. They were interested in what we're doing with our satellite School of Medicine. So there are all sorts of things that in the course of talking about or giving a presentation that I gave, that there were just many things that we could engage and talk about. One of the things that I found so beneficial was just having access to the trade commissioners and the embassy staff. They're very knowledgeable about the countries that they represent. Many of them have been there for a number of years, and they know who is involved and what they are doing. So having access to that, having met them, will be a valuable resource to our university. And as I said, it's all about collaboration. One of the things that became evident is that if Canadians want to work in those countries, then they really should try to identify a local company to establish a local presence in that country or go through an agent. And similarly, if they want to work with us, that's what we recommended on how to work with us as well. So in conclusion, as I've indicated, we have many commonalities. eHealth is being pursued in all of those countries in different ways, but along the same lines as what we're trying to do. Partnerships are very, very possible. I really see an opportunity for Canadian universities to partner with their universities and their industry companies, and it's definitely worth doing. And it was just a great opportunity for us to be part of that trade mission. To that, I want to thank all the people that contributed to our presentation and the trade mission. We contacted all of these organizations for their input. Most of them provided a short PowerPoint presentation or an information sheet, and I still have those, so if anybody wants some of those, I can provide that to you. In particular, I want to thank John Tennant and Catherine Gerhardt for their support. They were just wonderful in what they were able to provide me in terms of information before I left. They also created an information sheet on health informatics in the area, which is now available. They provided a few other little goodies for me to take along. And I must say that one of the most popular things that I was able to leave behind for the people on the trade mission, the key organizers, were the chocolate blackberries. In fact, people boasted that they got their chocolate blackberry. I was sort of embarrassed at times when I didn't have enough. But anyway, so it was good from that point. Here are some of the other contacts in Europe. A key organizer for the trade mission was Ewan Scott, and Alana did an awful lot of work as well. But they all did, and they're all very good people to, if you're traveling to those countries, to contact, and they might be able to assist you. I have a number of resources as a result of the trade mission tour. I have a number of presentations and reports that I can provide to people if you're interested. I have many of the European presentations, such as the one on action. I have the Canadian presentations, and of course I have the Waterloo information, including the Intelligent Waterloo information sheet as well. So with that, it became a tradition on the trade mission to end. I didn't really try, I initiated it, but my other Canadian delegates required that I would finish my presentation each time with, oops, better get out of here first, with a little video. and I'll show you that video now. And hopefully it didn't come on. Well, oh, it started. Okay, I'll try to get it to you as fast as I can.
Ansgar? Ja, der er jeg. Ja, så bra. Ok. Ja, hei du. Hei du. Ja. Ja, hva gjelder det? Ja,
Ok.
der er det her. Ja, vil du sitte? Takk. Ja. Jaha. Ja, så jeg har ikke fått gjort noen ting hele formiddagen.
Nei, jeg beklager at det tar tid.
I will start it over.
Holdt på å legge om til et helt nytt system, og da skal alle ha hjelp på en gang.
Ja.
Så du kom ikke inn i den?
Nei, den bare ligger der.
Ok, har du forsøkt å åpne den?
Ja, åpne den, altså hvis det hadde vært så enkelt.
Okay, let's try this again. It doesn't want to do that for some reason. There we go. Okay.
Broder Ansgar? Ja, der er jeg. Ja, så bra. Ok. Ja, hei du. Hei du. Ja. Ja, hva gjelder det? Ja, der er det her. Ja, vil du sitte? Takk. Ja. Jaha. Ja, så jeg har ikke fått gjort noen ting hele formiddagen.
Nei, jeg beklager at det tar tid. Altså, skjønner du, holdt på å legge om til et helt nytt system, og da skal alle ha hjelp på en gang.
Ja.
Så du kom ikke inn i den, eller?
Nei, den bare ligger der.
Ok, har du forsøkt å
That's
åpne
good
den?
enough, Don.
Ja, åpne den, altså hvis det hadde vært så enkelt, så hadde jeg jo ikke tilkalt helpdesk, hadde jeg vel?
Nei, det er
Nei.
sant.
Nei. Vil du ha en kopp varmt vann?
Nei, da, det skal være fort gjort. Det
Ja.
skal vi se. Du bare gjør der. Sånn.
Ja.
Da er vi i gang.
Ja, altså så langt kom jeg også.
Ok.
Ikke sant? Men så stoppet det opp, og så var jeg redd for at noe av teksten skulle forsvinne, så jeg turte ikke å gå videre.
Åja, ok. Nei, men du skjønner at inni her så ligger det kanskje flere hundre sider med lagret tekst. Så for å komme videre, så tar du tak i et ark på den måten her, og så liksom blar du over på neste side sånn. Da fortsetter teksten der.
Jeg blar, altså.
Du blar, ja.
Men når jeg skal tilbake, da?
Ja, da bare blar du tilbake igjen. Ta tak der, og så gjør vi sånn. Der, så er du tilbake til den teksten du hadde, sa ikke noe...
Ok, så den slutter der, og så fortsetter den der, ja. Ok, men når jeg skal avslutte på dagen, hva gjør jeg da?
Da bare slår du sammen permene
Ja?
på den måten der. Sånn. Da ligger alt lagret inni der.
Altså, jeg risikerer ikke å miste noe av teksten her
Nei,
nede.
alt ligger lagret inni her nå. Når du i tilfelle setter fyr på hele greia, det er kanskje lite sannsynlig. Så.
Ja, ok. Nei, men for det er noe med det at ikke sant, når du har holdt på med skriftruller,
Ja.
så tar det litt grann tid å konvertere til å bla i en bøk. Ja, jeg har av og til litt. Ja, men det er en før det går. Jeg skal bare gå gjennom en gang til. Altså, jeg åpner
Ja.
sånn,
Ja, riktig.
og så, hva du kalte det?
Blar.
Jeg blar,
Ja, blar videre.
blar frem og tilbake.
Ja.
Og når,
Teksten ligger her hele tiden.
ja. Og når jeg er ferdig, så bare lukker jeg den.
Oi.
Flott. Kjempefint. Ja, men du, vent, ikke sant? Nå er den sånn igjen, nå får jeg ikke åpnet den.
Nei, du har fra feil side. Du må åpne fra andre siden.
Så det er ikke likegyldig, det,
Du
altså.
må åpne fra den siden der. Sånn. Der. Der er den åpen.
Ja vel.
So that's it. Thank you for your patience in listening, and I'd welcome any questions. I'll try to answer them as best as I can. So as I said, that became the traditional end of the Canadian presentations. They would not let me stop without doing that. So
we have time for some questions and comments. So we get my microphone here. For questions and comments, I've got quite a few, but let's see if anybody else would like to ask something or make a comment. John, can you maybe say a few
I'd
words?
very
That's
much
right.
like John to
Here,
say
say-
something about the trade missions as well. That
Well, we thank you, Shirley, for taking this on. Having been at the other side of the equation in Canadian embassies and consulates general abroad, I think what bears underlining is that Canadian representatives abroad are very, very interested to tell the story of Canada and to be able to have someone, in Shirley's case, to tell the broad story of what's happening in Canada, not just at the University of Waterloo, as you emphasized, is really to them a very, very, very welcome asset to have. And all of this started with the visits of some of the trade commissioners from abroad who quickly realized that there was a great story to be told, and people like you who could tell it. So I think a key message is the receptivity that there is to a situation like this, where people knowledgeable at the University of Waterloo can be key anchors in helping tell the Canadian story. It adds a great deal of credibility to what individual companies might do. As well, while we keep talking about trade missions, I think what bears underlining is this is a lot more than just trade. It's about technology, investment, partnerships. All of these things flavored your presentation, because the opportunities for exchange these days are really quite incredible in this very complex world that we have. We, as Canada's Technology Triangle Link, have the task of seeking to market and promote the Waterloo Region, now known for over 20 years as Canada's Technology Triangle. And our objective is to attract investment here. What you were able to do certainly aligns very much with our objectives, which is why we were more than happy to get involved, Catherine particularly, in aiding this particular effort, because we have a strong congruity of interests. But without question, the best spokespeople for this part of the world are those that have the credibility of an outstanding institution like this, their own background, the information that they have. So your being able to be involved in this is a big plus for us all. Thank you for doing it.
Thank you.
Other comments or questions from you?
Okay.
Shirley, my question concerns a couple of aspects of this, because obviously this is right in line with what our research group has been doing at the Computer Systems Group for 40 years, is getting the story out. And we struggle with that. And Dominic, for you, I was meeting with another researcher on this campus about a week and a half ago, and get this one, he wants to start an institute. He's going to start an institute of like-minded researchers, 50 to 60 people, all over campus, and he has no idea how he's going to stay current with what those member researchers are doing. And of course that sounds familiar, because it's exactly the challenge that has worked so hard to try to deal with. And we've talked to former vice presidents of the university who constantly receive requests for, is someone working in this area? And how do you stay in touch with what 1,000 researchers on this campus are doing and stay current? And I'm, in the context of a trade mission, I'm wondering, you were able to present a snapshot as of February, March of this year. How do you keep that current? I mean, we all have websites, and none of us are particularly good at keeping them up. One of the things we do, of course, is videoing presentations and presenting them that way. Were any of your presentations videotaped? How effective is the trade mission story in getting the story across, and do other people have similar problems? Even in the intelligent community context, those folks in New York are struggling with finding bright ideas anywhere in the world on neat ideas for communities. And they can't all have a conference and bring everyone to New York or Waterloo or Stockholm or wherever. And so how effective, I guess, do you know, or is there a way to measure it?
Yes, indeed, they were snapshots in time. And I guess a couple of answers to your question, because I think it takes more than one answer to answer your question. We've relied in the past, and I think still to today, with personal connections for getting our information. So do you know who is doing what? And so the trade mission in this case provided us at least with key contacts in those countries that we can now have that personal contact with. And they have resources because they know the people that are doing work in their areas. But that is a rather cumbersome way of trying to get information, and that was hence one of the reasons why we proposed the HI dating game, very much based on the Volunteer Action Center technology that CSG has developed, in which the organizations that are looking for certain skills and capabilities are married with people that have those skills and capabilities. And could we provide that type of information for our university? And could they, in those countries that we visited, provide the information on their side so that we could start to mine that information together so that we could know a little bit better what each other's doing. Now, you've raised a really critical problem in that is how do you keep it up to date? And I think that has to be driven by the people. If they really see that as something of value, then they will take a mechanism, or they will create a mechanism for keeping it up to date. But it really has to be pushed by a need. And if they don't see that as a need, then it won't be kept up to date.
They have to they have to know they have a problem that can't be resolved by the usual ways, and that this is a solution, and it's worked in another environment. That's sort of the diffusion of innovations concepts, and there are very few examples of this that you can show people, and this is why I think it caught on as a possibility. But the biggest single problem is keeping it up to date. By the way, I don't know if we're interested in marrying them together. Maybe just a meaningful relationship would do. I want to ask a similar question. What would you do? You had a very rushed, I mean, I don't know how Shirley did it. She came back semi-comatose, I think, for a few days. But, you know, it would have been impossible for me, for health reasons, to do it. How could you make an experience like this better? What would you do to have improved the outcome? Would it be more of the same as a volume issue, or more concentration, or some mixture, or what? What would have improved the experience?
A little bit more time would have been certainly beneficial because we were really just flying. I mean, I think at one point I said if it's Thursday, it must be Belgium. And it was. We flew into Belgium Thursday night, and we'd already visited Finland, Sweden, Norway, and Denmark by that time. And that, you know, that started on a Monday, and by Thursday we were in Belgium. So the lack of time was an issue. But on the other hand, I have to realize that this is a very expensive event that is being showcased, and to increase the time increases the cost. So I don't know what you can do about that.
And this was supported by the agencies that, how was it supported precisely?
Supported by the Canadian embassies in those countries and the consulate in Munich.
So they picked up the bill for this, which is also, you know, I think one of the problems we often view trade missions as sort of like fun things to do. I mean, when I look at the preparation, you're being there, and then the immense follow-up afterwards, they're anything but fun. And of course, the question is are there better ways of doing them? And it'll be interesting to see, you know, what we learn from it.
There may be better ways of following up, but I would still say that the personal contacts that you can make while you're there to build those relationships, because you do need to have some trust in relationships, and that needs some sort of basis to build on. I don't think you can just sort of do it by email connections, or it would be very rare to have those successful. I spent in each of my presentations some time trying to engage with the audience as to what might they find of interest in terms of what I was saying. And so I taught them, pardon me, I taught them a little bit of how to speak Canadian, the word A. It's two forms of usage, and I gave them examples how to use it and so on and so forth. I engaged them with their sports figures that I knew. The situation where I was outraced by an 86-year-old Finnish cross-country skier when I was 23, and that I had people from Holland that worked on our farm when I was knee-high to a grasshopper, and they were like brothers to me. Those are all ways that you can do in person, but I don't know how you do it in any other way.
We had with the Ministry of Research and Innovation, this is Bill Mantell and other sponsors, Roger Pan, about a year ago. We had a session in which we talked about communities of practice and establishing communities of practice, and then, of course, the technology to support that. I mean, what was interesting, that came out of our first full day and a half meeting, was in order to have the community of practice support system, you need a community of practice. And very little, although people were looking at technology, very little was being done by people they call social artists to actually create these communities. I think what you've done here is similar to that on an international scale. You've created a sort of a community of practice that hopefully will continue and will make a difference in the future as to what we do. I guess the other thing I'd like to mention is that the work like this, the person who's been the premier person in Canada to undertake these international connections has been Dennis Proti, P-R-O-T-T-I. Dennis is at the University of Victoria, so if anybody wants to look more deeply into this material, Dennis has published enormous amounts of material on various countries. He's spent months, even longer, in the countries, and has produced a very valuable archive of knowledge of the countries, their culture, health informatics within those countries, educational programs, and so on. And I think has done a similar thing in bringing the Canadian experience to those countries. So that's another outcome that you could get from this effort. Any other final comments or questions anybody wants to add? If not, thank you very much, Shirley. You want to make a couple of announcements, I believe. You told me not to let you forget.
So now I can switch from my speaker role to my traditional role as the person that operates these seminars. And so we have just a few announcements about upcoming events, and I would like to make sure you know about them. As you know, we operate as well the Smarter Health seminar series. Dr. David Koff is going to be speaking on Wednesday. He's recently moved from Sunnybrook Hospital to McMaster University and the Hamilton Health Sciences. And he's going to be speaking on managing the medical image tsunami, reducing data volume. So we are, as a country, as a region, as a hospital, generating more and more medical images. How are we going to cope with the increasing volume of these medical images? So he's a good friend, and I hope you can come and hear his talk. As well, the next month, on Wednesday, March the 28th, John and Catherine, you might be interested in this. Tom Vare and Michelle Corrine is coming from the Sault Ste. Marie Innovation Center. Did I say March? May 28th? No laughing aloud. So on Wednesday, May 28th. And they're going to be talking on geographic information systems for community health. Sault Ste. Marie has been very instrumental in using technology along with GIS to really promote community health. And so they'll be speaking on that, and I think it will be really interesting, something that I think our community could be looking at as well. And last but not least, we have the Health Informatics Bootcamp coming up in June, June 18th to the 20th, and we're taking registration now. It will be held at the University of Waterloo, 2.5 days, and we just, as soon as people arrive, we start running, and we don't stop until the end of the day on Friday. So if you're interested in attending, please let us know. And that's it.